Hello and welcome back. This is Dr. Mridula here. So many a times my patients come to me saying that they're not able to see clearly. So then I evaluate them and then I finally give them their glass prescription and ask them to get these glasses. So the patients look at the prescription and all they see is, few letters and few numbers, and most of them have a very confused, bewildered, look. Some of them ask me and then I explain it to them. So I thought I'll just take some time today and let you also know what exactly the prescription is all about, those letters and numbers. So generally on the top of the prescription or towards one side of the prescription, you will see something written as RE, which is right eye, and LE, which is left eye. So in some cases, instead of RE and LE, it can either be written as OD, which is oculus dextrus, which is right eye. Another one is OS, which is oculus sinister, which is for the left eye. So just below that, you will see something written as SPH, which means the spherical prescription of the glass power. So now this spherical prescription is basically based on the size of your eyeball. Now this can usually vary with age, okay, and tends to remain constant by around 18 to 20 years of age. It tends to remain stable. Okay, so next to this prescription power, you will either have a minus sign or a plus sign. Minus sign means nearsightedness, or that is myopia, wherein the near things you're able to see clearly and you require a prescription or a power to see far things better. And if it's a plus sign, it's also called as hypermetropia or far-sightedness, wherein far things you're clearly able to see, but you will require a power or a prescription to see near things better. Okay, so in case if I say the power is -3 diopter, which is written right under the SPH column, it means that you require a power of -3 for nearsightedness. And D is called diopter. That is the unit which we use to measure the lens power. Like for everything we have a unit, right? Like kg, liters, milliliters, centimeters. Like this, diopter is a unit which is used to measure the lens power. So now coming to the next column where you have something written as CYL. Now this stands for the cylindrical power. So an eye with astigmatism will usually have a cylindrical power and an axis. So this cylindrical power is based on the curvature of the cornea, mainly. It can either be curvature of the cornea or lens, but it mainly refers to the curvature of the cornea. So let me put it very simple for you. Now, normally the cornea is uniformly curved. Okay, so it is like a basketball. That is, it is uniformly curved. Now you turn it into any direction, the curvature remains the same. But in individuals who have astigmatism, the cornea is not uniformly curved. It's more like a shape of an egg, wherein it is curved more in one direction and it is less curved in another direction. Okay, so now this cylindrical power, this will help to correct the curvature of the cornea so that it becomes uniformly curved. Okay, and next to the cylindrical power, you also have something written as axis, AXIS. So now this will tell us if the curvature is in which direction, whether it is curved in 180 degrees or whether it is curved along the 90 degrees. So based on that, we will give them the correction. In some prescriptions, you will also notice that there is one column down which says AD or NV, that is for near vision. Wherein here, especially for individuals who are above the age of 40, they will find it a little difficult to read small letters which are kept at a very close distance. Okay, so for such individuals, you will have to give them an extra reading correction or a presbyopic power. So this is what we will write in that add column. So in certain prescriptions, you will also see another column where it is written as prism. Now, this is a special type of corrections. Not all patients will require it. This is basically for patients who have double vision. That is, a single object, they see it as two separate images. So it becomes very difficult for such individuals, right? So this prism, which has been incorporated into the lens, helps to fuse these two separate images so that they can see it as a single image. So I hope I've made it clear for you. So at least the next time you see a prescription, you clearly know You have a spherical power, which is based on the size of the eyeball. You have a cylindrical power, which is based on the shape of the cornea. Then you have an AD, or a near vision power. This is basically used for individuals above the age of 40. And you also have a prism power. Now, this is mainly for individuals who have double images or diplopia. Okay, so I hope next time you're more comfortable when you see a prescription and you have no such queries. Thank you. Take care.